When arriving in clinic, head straight to the distilled water area to don your PPE. If you decide to wear a bandana, make sure that all your hair falls underneath the covering. Any loose hairs that are outside, tuck them underneath as you see our clinician doing here. Next, we need our mask and our eye covering. Our clinician already wears glasses, so she's opting to grab some side shields to place over them. Next, we're going to grab some blue gloves before we start to handle the purple gloves. Notice how our clinician is pulling her patient gloves over the gown sleeves before she handles the purple gloves. Hang your purple gloves in the cabinet in your operatory and begin your 30-second hand wash. Next, our clinician needs her face shield. Then we'll place on her clean blue gloves. Now, our clinician is going to turn on her air purifier, grab her purple gloves, and begin adjusting her patient chair. When adjusting, make sure your knees and thighs are parallel to the floor. Now, start wiping your operatory. When wiping, use a two-handed wiping method. Wipe all the handles, lift everything off the countertops, and wipe underneath. Be careful not to hurt your back. Wipe every chair in the operatory, every handle on the chairs, and make sure you're switching your cavi wipes in between. Do not keep wiping the room with the same dirty wipes. Next, we're going to wipe the patient chair. Again, the best thing to do is multitask throughout the entire wiping session. Notice how the clinician lowered the chair as she kept moving. The faster that you move, the better for you. You only have a few minutes to get this done before your patient comes in. Next, we're going to move on to the pony wall. You want to assume that this area is dirty. Don't come into clinic and set your backpack here. Put your belongings inside the cabinet until you've wiped it clean. The next thing we're going to clean is the air water unit. Notice the clinician is wiping all the knobs, all the handles. She pulls every cable out of the unit and drapes it over the top. You want to make sure that you're not putting them back because you are going to do a second wipe, so that's just kind of saving you time if you drape them over the unit. Lastly, wipe your water bottle. You're going to head to the sink, wipe all the handles and the countertop thoroughly. Repeat the process in the same order one more time. On this wipe, when you reach the end, return all the cables to their places in the unit, wipe your water bottle one more time, and wipe your gloves twice. Set them to dry on a paper towel. Remove your patient gloves and proceed with a 15-second hand wash. With clean hands, head back to your unit, remove your water bottle, head to the distilled water area, and fill your water bottle at the sink. When placing it back, be very careful not to touch the blue straw. Turn on your unit and head to get your patient tray. From here forward, just keep infection control in mind. You're carrying sterile instruments that will be for the patient, so make sure you're not touching anything dirty along the way. Grab your patient mouth rinse and head back to your operatory. Our clinician still has clean hands. She's going to start purging her water by filling up a cup twice and drawing it into the sink. Now it's time to place your barriers. Start by placing a bag over your central unit and placing the items that you're going to use on the top. Bring your tray into your operatory and place your patient garbage bag on the side of your unit. Do not place it on the wall. Now start placing all of your attachment on the designated holders and continue to place your barrier tape on all its designated areas. Armrest, buttons, mouse, air purifier, and on your chair. Anywhere that you cannot clean well should have barrier tape over it. Now our clinician is grabbing these barrier sleeves. These are going to go over the handles of the light, over your air water syringe, and your suction. Save one for your pen. Place the pen inside and tie the end. Lastly, place a bib over your patient tray. Put on some clean gloves to touch your purple gloves and hang them in your cabinet. Remember, sanitizer is allowed. You do not have to necessarily wash your hands between each step. Now, seat your patient. When it's time to dismiss, make sure you hang your coat on the rack before you lead into the lobby. No PPE beyond this point. Return to your operatory. Make sure the sterilization strip is outside of your cassette before you close it back up. Wash your hands, place on some clean patient gloves, and don your purple gloves. It's time to take your cassette back to sterilization. Grab a red bucket, bring it back to your operatory, put your instruments inside, close the lid, and take your tray with you. Arriving to sterilization, open the hydrant with a paper towel, place your instruments inside, and wipe your container twice. Wipe your tray, place it on the rack to dry, and head back to your operatory to wipe it down. Notice the clinician opens up the bag and uses it as a trash can. So she's going to put all of her barrier tape inside to throw it all away in one big swoop. Next, the clinician is going to start wiping her operatory, starting with the dental unit. After one wipe, it's time to prepare your VacuSol. Use 1 ounce of the solution into the container and fill it about halfway. That'll give you enough to use for 2 operatories. You will share this with your neighbor. Use the port staple number 1. Continue with your second wipe now. At the end, wipe down your hoses one more time. You're going to wipe down the VacuSol container and return it to the cabinet. Now it's time to wash your purple gloves with soap and water and place them on a towel to dry. Grab a towel, set it on your chair, lift it to the fully upright position, and place the rheostat on top. Wash your hands 2 times and dry them well. With clean hands, you're going to fill up 2 cups again to purge the water. Turn off the unit, remove the water bottle, and empty the contents into the sink. Be very careful not to touch the blue straw when putting it back on. Place the light over the dental chair, turn off the air purifier, and turn off your computer. Put on clean gloves. Wash your items with soap and water that can't be wiped with a candy wipe. Return your gloves to their bag and place them back into the sterilization area in its designated folder. Close the lid to the container and place it back where it belongs. Now, you're done. Time to remove your robe and place it in the laundry area and remove your cap. You guys did it! Good job! It's not too much, right?